Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders, viewable on YouTube and Oppenheim TV. I'm your host, Mark Oppenheim. Today, we're talking with the leadership of the American Brain Foundation, Michelle Heritage, Executive Director, Heather Heart, Director of Philanthropy, and Julia Miglets-Nelson, PhD and Director of Research Programs and Partnerships. Thank you so much for being here. It is just wonderful to be talking with you. And Heather, let's start off with you because you've just joined the organization and you're just experiencing this wonderful organization as the Director of Philanthropy. Give me your pitch for why I should be contributing to brain research that is vetted by the American Academy of Neurology.
Well, at the American Brain Foundation, we are doing some pretty incredible things. Our early career researchers are really making a difference across the spectrum, and we are incredibly proud to be able to raise dollars to support their work. And as a newcomer, I'm really, really proud to be a part of this team, to have the conversations that I've already had with some of these researchers and to be able to share that message and provide that opportunity with our donors. It's a great place.
So what you're saying is that if I or any of my family have a condition, it could be anything from migraines, it could be ALS, it could be any other neurological condition. And in our age, as we age, we are likely to encounter some of these. I should be concerned about the research that you're doing.
Absolutely. So the work that's being done just builds on each other. 1 in 3 people we're aware of are actually affected by brain disease, whether it's migraines or ALS or any of the things that you talked about. So the work that we're doing and the work that our researchers are doing that we are able to fund from the American Brain Foundation will have an impact because it all does relate to each other. So not only are we able to help with research today, but it will also build on that in the future.
It's terrific how you've been able to really adopt the messages that are being shaped by Julia and Michelle. We're going to go over to you, Michelle, because you also are fairly new. We actually recruited you to be in this position, but you came from a non-usual suspects role for this type of a position. So talk a little bit about your past experience and how you have been able and the changes that you've wrought with your team in the organization very quickly are just phenomenal. So talk a little bit about your own career trajectory and how you came to the American Brain Foundation.
I've spent my entire career working with people who have been experiencing deep poverty and challenges, usually with things that are made worse by poverty. And so I have worked with abused and neglected children. I've run homeless shelters. I've run drug and alcohol treatment centers, worked on the hospital units with people recovering from addiction. And I ran a large mental health center for very young children with very severe mental health challenges. And most recently, I came from running a community organization that was focused on preventing and ending homelessness for the entire community, and really bringing the community together around one message, one way of thinking in terms of working together, bringing multiple voices, perspectives together to really crack a very difficult challenge, which is how do we help people who are experiencing homelessness, both to prevent homelessness and then to end the homelessness quickly of those who are experiencing it. And although it is quite different, the work I'm doing now, it is and it isn't. And for me, one of the number one things that I have to see in an organization in order to be interested in leading it is that they are really thinking about how they are working on a new way of finding the answers to really tough problems. And one thing the American Brain Foundation does is focus on how to bring people together. We've got a multidisciplinary approach. We're disease agnostic, and that means we're funding across all of the brain diseases, more than 600. And what we're interested in is finding research that we can fund where if you get a breakthrough, a treatment, a cure in that disease, it's going to apply to many others. And a lot of the ways that you can do that is you bring together maybe not always the usual suspects. We want to see projects where people are working across disciplines. Maybe on your team, you do have the best neuroscientists in the country, but maybe you also have an engineer or an architect or someone from the biosciences. Maybe you have got somebody that's in a venture capital or startup. And really putting these brilliant people around the table to crack some of the most difficult challenges and some of the most devastating illnesses in the world. And then, secondly, I have to believe that the organization is incredibly credible, that the dollars that are being spent are put to highest and best use for the mission. And I have to also have something personal, some skin in the game. And as Heather said, 1 in 3 people in this across the globe will experience a brain disease personally in their lifetimes. And that means that every single person will love or care about somebody who has that, or they will experience it themselves. And I'm a person in both of those categories who both has experienced a brain disease and also have had a devastating toll taken on my family by brain disease. So a lot of the AVF staff, I will say, many of us are very. It's a very close and personal mission that compels us to try to help these incredible scientists find treatments and cures.
So one of the things that I think is so fascinating about your story, Heather, is this idea that when you're serving people in poverty who don't have the funds to receive treatment, particularly early stage treatment, let alone medical treatment, that manifests, they have to kind of live with what they have. And what you're talking about when you're talking about brain research, you could be talking about Alzheimer's, you could be talking about dementia, you could be talking about the various conditions that manifest as what we commonly call schizophrenia. We could be talking about autism, learning disabilities, right, Julia? So when Michelle is talking about these research threads and bringing people together from different disciplines to inform your work, how do you actually shape those research programs and those partnerships to bring those people together, get them into the same room? Each of them may be looking at the problem from different perspectives and dialoguing with each other, because what Heather, what Michelle is saying is that you are not dedicated to silos. You are dedicated to solutions, and you bring people together to create those solutions. How do you actually ensure that your work, Julia, brings the right people together?
Well, I think what really works in this space is approaching the problems with a sense of curiosity. And I see that from our staff. I see it from our scientific leadership. I see it from our funded researchers, our partners as well. Just getting people in the room together to talk about the kinds of research that can lift all boats. We were just at one of the biggest neurology conferences in the country about a week ago, and I was talking to one of our early career researchers who's studying a really rare pediatric condition called adrenoleukodystrophy. It's okay if you've never heard of it. I hadn't either before I started this work, but it's completely devastating. If a child has ALD, the prognosis is just not good. And there are some treatments out there that will work for a subset of this population. And she was talking to me about how her research originated. So she's studying the effects of vitamin D treatment on the brain. Vitamin D, you can get it over the counter. It would be an incredible innovation if it works. And she actually came up with this idea by talking to someone working in multiple sclerosis. The research that she's now doing has implications for a number of other diseases. And I feel like that really exemplifies this approach of let's be curious, let's ask what if. And that happens when we have our research advisory committee together asking these big questions. What if we approach this from a different angle? I think our partners really value that approach as well. They're really incredible at working in their disease space, and there aren't often chances to come together around a big cause.
Michelle, talk about the relationship between the Academy, the American Academy of Neurology, AAN, and the American Brain Foundation, because it's a 40,000 member strong group, international membership. Although it says American Academy, it's basically it's the professional community for neurologists internationally. How does that actually function to ensure that the research that receives investment from donors, that research is vetted and is effective in the cure one, cure many sense that is one of the watchwords of the American Brain Foundation?
Absolutely. So the American Academy of Neurology is a very important strategic partner for American Brain Foundation. They actually founded us many, many years ago. We've been independent now for quite a few years, more than a decade. The American Academy of Neurology, as you said, is one of the largest membership organizations globally for neurologists, and a very, very high percent of all neurologists are members of the Academy. And what we do with the Academy is this, when we are forming initiatives. So, for example, right now we're working on what I'm calling a Swing for the Fences, a very large brain health initiative. And we are aligning with the American Academy of Neurology's brain health strategic plan. And by alignment, I mean that we've recognized that the best scientists are really starting to do quite a bit of research and showing that prevention is very possible. With brain disease, a lot of times people say, why would I want to know if I'm going to get Parkinson's or Alzheimer's or any of that? Because what can I do about it? Well, you can do a heck of a lot. And the earlier that
prevention, really,
very cutting edge. And a lot of people don't realize it. As much as 2/3 of kind of lifestyle choices and some other things are what impacts the pathway if you get a brain disease. And then once you do, if you do get it, kind of what happens in terms of the prognosis. So what do we do with the Academy? Our science committee at American Brain Foundation works diligently on deciding what the cutting edge science is, what initiatives we should pursue, and works to develop that. We have some of the most brilliant neurologists and neuroscientists in the country on that committee. And then we go out and we raise dollars for the initiative. This is our third one we're starting. Our first was in Lewy body dementia. Our second that we did was in neuroinflammation. And the third now is going to be brain health and prevention. The American Academy of Neurology, then we basically work with them for the back end to decide on the particular projects that are going to get picked. So we put together an RFP, the projects come into the American Brain Foundation, and then we say, okay, American Academy of Neurology, you've got access to these thousands and thousands of neurologists and neuroscientists. Could you convene expert science committees to review these applications and tell us which ones are the very best of all? And so the beauty of investing in the work of American Brain Foundation is on the front end, you've got some of the most brilliant neurologists and neuroscientists deciding what the best science is to pursue. We raise the dollars. And then on the back end, you've got some of the most brilliant neurologists and neuroscientists deciding the very specific, particular projects that the recommendation is to fund. And I think that's a really beautiful, highest and best use of those dollars to mission to have the greatest impact for people.
So Heather, if I'm an investor donor and I am coming to you and I'm saying, why should I invest? You're basically functioning as a donor advised fund in a really specific sense, using the resources of the American Academy of Neurology, but also your own community to create this advisory capability so you're not just soliciting, you're also helping these investors receive advice. And that's part of your value proposition, right?
It is, absolutely. And it gives us a chance to have those conversations with donors, to really feel them out, to see what their interests are. and to be able to use the dollars that they give us to support work across the system.
I'd like to talk a little bit about the next generation research grants, and please, anyone should just jump in, because I think it's really what is the word? It's easier to always go to the people who have already been tried and true and not invest in the up and comers, right? But if you do that, you miss so much opportunity, because while the risk might be higher to bring in a new researcher to address these problems, the rewards are also amazing, because every once in a while you hit on somebody who is absolutely brilliant. They will be the lead person in that field in the future, but they haven't quite made their rep yet. So talk about these next generation research grants, because I think it's quite distinctive and perhaps a model that others can follow.
So Julia, I'll just do setting up the table, and maybe you could talk about the incredible success of these researchers and the work we're doing. So the thing about the next generation research to really, really understand is we're almost always the first dollars in, and these are highly vetted researchers. They're in a mentored environment, and we really are helping them get their labs up and going, getting their first data for their projects. But the most important thing we're doing is we are launching scientists into what will be decades-long careers. Most folks don't really understand that to be a scientist, when you've got the kind of education, these are PhDs, PhDs, MDs, they could take a clinical track and frankly make a lot more money. And what we want to do is help to support them to become scientists, to dedicate their life to becoming scientists. Some are scientists, clinicians. And the only way we're going to get those breakthroughs and build on that body of knowledge is if we continue to bring young and early career scientists into the work. And so, it's kind of like sometimes we joke and we call ourselves, we're like the pre-K, and the K is the big National Institute of Health grant. We're the pre-K, just like in early childhood education. Why do we care about that being high quality? Because you've got to start somebody off right in their schooling, and we're trying to start somebody off right in their career. We have so many of our next gen researchers that have told us, had it not been for us, they would not have been able to be scientists. And then we lose the entire decades long of that brilliant mind and the work that they're doing. So I love this program so much. It's like it is so great to be part of thinking about launching these careers. And Julia, would you talk about some of the success we've had with this program?
We found out through a program evaluation that actually 98% of our over 300 recipients have gone on to get that additional funding that Michelle mentioned. I think that's a pretty high seal of approval on the work that we're doing. And on top of that, they've gone on to publish and be cited almost 1 million times. We have folks cited in patent applications, which means that the research that they're doing is having demonstrated real world impact. It's getting into the hands of patients. So we're really, really proud of those folks by those numbers. And when you talk to these researchers, not only are they just really grateful for the support, but they're incredibly passionate and excited about what their research could do for patients, for people affected by brain disease. And that, to me, in this role is very inspiring to know that we're funding people who are not just, putting out these incredible metrics, but they're really doing work that affects individual people and families and those that care about those with brain disease.
The thing that I note is how, Julia, you cited the fact that you measure the outcomes of what you do. And so this whole idea of philanthropy actually leading to an outcome. There are investments that are being made. There are outcomes that are being achieved. You can report on those outcomes. It's very, very, very businesslike, isn't it, Michelle?
Absolutely. And, outcome and impact is what we're after. That's what's really important. I do want to say one of the other things that are really interesting from, we've looked at the study we did on all these researchers, and some of the folks that we funded early on are in some of the most prestigious institutions across the country, leading some of the biggest neuroscience programs and neurology departments, leading neurology and neuropsych in major universities across the entire country, at Harvard and Washington and UCSF. And I mean, it is just something else. And we had one that we funded not recently, but early on, who went on to discover a gene that is now reversing some of the effects in ALS. ALS has been a disease that basically has been incurable. It locks you into your body. It's horrifying. And we funded a researcher, got her career started, who is now an eminent ALS scientist, working over, with Harvard and UMass Brigham, and we got her career started. And she has said to us, I don't know if I would have been a scientist had it not been for this. And she's discovering cures for ALS. We've got a researcher we funded last year working AI, using chatbots to do early diagnosis on Alzheimer's. And I mean, it's every time I go to a lab or have the opportunity to visit with these folks, my hair is just blown back about the kind of work that they're doing, and that we were involved in any way, shape, or form with the kinds of things that they're discovering and the cures that they're finding.
Now, as you're looking at the future of this type of research, one of the things that we're hearing so often in the news is some insecurity surrounding funding for basic medical research. We're having a stressed moment between the government and universities that drive some of this research. We're seeing the National Institute of Health grants being stopped, the CDC grants being stopped. How does your whole ecosystem feel about what's going on? Are people afraid? Are people how are people taking it? It must be a huge topic of conversation, right?
Here's the thing. I think, we're extremely concerned about the funding cuts. We're extremely concerned about the staffing cuts. We're concerned about the lack of understanding about why it's important to fund the labs as well. These laboratories, in order to function, have to meet safety standards and requirements. They have very expensive equipment, all the things. We want the cures, and so it is, I think, a misunderstanding to think that we shouldn't fund not just the salaries, but we need to fund the other things that go along with that, that are in the overhead costs. Those things are very important. I think cutting anything to early career scientists, we're seeing some scientists that have been working in the middle of a project and it's no longer going on. These things are all very concerning. And here's what I'll tell you: when we punch a hole in the science very much is a build. It builds and builds and builds. Julie just said our early career scientists have been cited almost 1 million times. Why do you care if they've been cited? Well, because that citation is, hey, we learned this over here, and now I'm going to take that, I'm going to build the next thing on top of it. And science literally builds on top of the knowledge and on top of the knowledge. If you don't have the science continuing to flow, then that doesn't build. And I'm telling you, we are going to punch a hole in the ability to find cures and treatments and breakthroughs that literally could be decades worth of damage. And I am not being overly dramatic. Decades worth of damage of the science that we will lose. We as a country are a leader in the world in terms of science and research. And we don't want to not be number one in that, because we need the cures, especially for brain disease. These kinds of conditions steal our humanity. They take a toll on our families, a toll on ourselves. They take a toll on our communities. And so we are really concerned, and certainly are advocating to help people understand some of the nuances around why this kind of funding is important.
One of the things that seems to be the case is that the research that you do it actually connects to a whole ecosystem, a commercial ecosystem of care, a commercial ecosystem of drug development, of medical devices, a whole ecosystem that if you ask that commercial ecosystem whether they could do without the fundamental research, they would say, "Are you out of your mind?" Because those companies cannot afford the risk. And what you're doing is you function as an R&D arm of the entire medical commercial space, don't you? I mean, are you finding, Heather, when you approach people, that the people that you approach also have a business interest in the downstream adoption of some of these this essential research in order to create those drugs and those cures and those approaches that later on a business, a major corporation might commercialize? Because one of the things that I think isn't sufficiently appreciated is that it is a whole ecosystem of care, of people, of businesses, of doctors, of educators. It's the whole thing. So you're kind of breaking apart something that actually works quite well.
The ecosystem, we all rely on each other. And when I talk with donors, I do have the opportunity to really talk with them about the impact that their gift will have. And they can see during those conversations that it does go downstream, like you talked about. The reality is their gift may be funding one of our next generation researchers who will have an impact and kind of a snowball effect or a ripple effect on some of the research that's being done down the road too as well.
Well, the reason why I asked you is that when we were working for the American Brain Foundation, a lot of the people we talked to, donors, people on your boards, researchers, and so on and so forth, they actually have multiple interests. Some people are living with conditions. Some people have families who have conditions. Some people are leading commercial entities that are providing treatments. Some are working on drugs, and so on and so forth. So it's not one of those things where you can basically say, well, let's take all that government money that goes into research and let's now send it into a commercial space. If you went to the commercial space, right, Michelle, right, Julia, you wouldn't have the same kind of research being done because the risk structures for a commercial entity are different. The risk appetite is different than for a nonprofit or for a government agency that is funding this type of research.
Well, and here's the bottom line too. And if you are working to commercialize a particular thing, you are going to go with your highest bet, the best bet you can place, right? So the best bet you can get, the biggest ROI that you can get, when the science is not funded at the beginning, especially in a commercialized way, you're going at the best science where you can get the best result, right? Whether you're not looking at the commercialization purpose, you're looking at, can we do this research because we think we can get a breakthrough, versus can we commercialize this product? That is really at the very far end state, but you've got to do all of that beginning stuff first, or you'll never get to the end state of a commercialized product. Because what the scientists are looking at is this the rock solid science that I want to go after? The secondary thing is this. What happens when you only are looking at, on the commercialization side and putting all the money there is many, many, many rare diseases. When you put them all together, it is a lot of people, millions of people who might suffer from a rare disease, okay? Those things are not things that tend to get commercialized treatments or drugs because they're not a big bang. They're not a big ROI. It's not, Alzheimer's, but, it might be CMT. And often those rare diseases are extremely devastating to children and to adults. And so we don't want to leave all those people behind. And there's millions of them when you add all the rare diseases together, because that's not a commercialized product. When you think about how far we could swing in terms of losing on the science side if we just went to what was easily commercialized, that's going to be a huge challenge. And the other thing I will say is some of the prevention stuff is not commercialized. Okay, we're talking about things like, I need you to sleep I need you to sleep well and get certain kinds of sleep while you're asleep. I need you to be connected to your family and your community and feel that you are cared for and loved by others. I need you not to drink too much alcohol or smoke cigarettes. And I need you to have a weight that is good for your body. And I need you to exercise. That's not, none of that can be very commercialized, right? But those things I just said are about 2/3 of preventing some brain diseases. And so we don't want to also miss out on the research that is a big part of what can keep America healthy.
The research push now is to understand the why. Why is sleep protective against brain disease? Why is healthy diet protected against brain disease? We've known for quite a while that those factors are helpful. And so now scientists are asking, well, what's the why behind that? Because if we understand what is causing those factors to be protective, that could be commercialized. So maybe you can't get perfect sleep, but maybe we could develop a treatment that would sub in for that restful night's sleep.
Well, exactly. It's almost a lifestyle change. Plus, the cost to society in aggregate, which was the point that you were making, Michelle, the cost of society, which might go unrecorded, is absolutely enormous. So the research is actually by making us healthier, by allowing us to live longer with all of our facilities and in a vigorous and joyful way, that actually is an off the books benefit. It's absolutely measurable, isn't it?
Yeah, absolutely.
So this has been a fabulous conversation. I want to thank you all. The one thing that I want to also point to is that research has impacts for everyone. Michelle, you started off talking about the fact that you have provided through your career services to all sorts of different people, very often people living in poverty, people who have mental health challenges, people who are affected just like everyone else by these neurological conditions, and taking that skill set and moving them into this area for which you have a heart is just fabulous. I'd like to also thank Michelle Heritage, Executive Director, Heather Heart, Director of Philanthropy, and Julia Miglets-Nelson, PhD and Director of Research Programs and Partnerships. Please thank your board, your funders, your investors, your staff, all the people who also are part of your community, including the patients and the researchers. You are working for us all. Thank you so much for sharing the insights into this field with us.
Thank you so much for having us today. We so appreciate it.